October 24th meeting of the Rotary Club of Louisville. Keep hearing it's so hard to think that this year is rolling by, and you know, when it hits this time of year, we'll look up and it'll be January 2nd. So anyway, get out and enjoy these warm days while you can. I'm Lori Flannery. I'm the president and CEO of New Directions here in town. It's a local nonprofit. I'm also the president of the club this year. I'm very honored to be so. And I'm a Paul Harris Fellow. I would like to remind you all, if you have a device with you today, if you will please take just a moment to make sure, and I might do that myself, just to make sure that you have it turned off. I know we go through our days with it on, off. So this would be a time where we would want it to be off. Thank you very much. I wanted to share with you, if you haven't already seen, that longtime Rotarian and club member Dr. James Jim Bruce Appleberry died peacefully in Louisville on Monday at age 86 from complications of pancreatic cancer. He served as vice president of the Pittsburgh Kansas Club and was a member of the Marquette, Michigan Club prior to transferring to our club in August of 2000. He was a Paul Harris Fellow. His service will be at Second Presbyterian Church at 11 a.m. on Saturday, October 26th, with an open house reception to follow in the party room at 5800, it's probably up there too as well. Yes, 5800 Coach Gate Wind in St. Matthews. So I'm going to ring the bell for us to have just a moment of silence to honor him. Now I will invite to the podium Steve Jester. He's going to be providing our invocation today. Steve is a retired pastor of Second Presbyterian Church and Paul Harris Fellow.
Thank you, President Lori. And I just want to take a moment of personal privilege to say that Jim Appleberry was one of the finest human beings I ever knew. And I'm deeply grateful for his life and his witness, and invite you to give thanks for him also in your own way. The Jewish scriptures and the Christian scriptures both are filled with stories of healings. And I'm sorry that I'm ignorant of the Quran, and I don't know what's there, but in those two traditions, healing stories are prevalent. In fact, in the Greek language of the New Testament, or the Christian scriptures, the word for salvation is healing as well. And so to be saved is to be made well, to be healed. So as we gather here to hear about the many instances of healing and of hope that are happening now, let us turn to the one whose deepest desire is for the wholeness of all his children and for this creation. Compassionate and gracious healer, we are grateful for the many ways you are at work to mend what is broken. We are grateful for all who use their intelligence, their skills, their energy to partner with you in that healing. Make us mindful as this collection of your people known as the Rotary Club. Make us mindful of the resources and the creativity and the passion you have given us. And give us the will to use all that we have and are to bring wellness to this world and its peoples. We pray it in hopeful expectation. Amen.
Thank you, Steve. Now to lead the pledge in the four-way test, we have Chris Manzo, owner and principal of Sandbox Design Collaborative, and Paul Harris Fellow +1.
All right. I pledge allegiance to the flag, United States of America,
and to the republic for which it stands, one nation, under God, indivisible,
Saw the flag there. Realized, I watched some eyes, I realized the flag. All right, the four-way test. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned?
Thank you very much, Chris. Okay, this is the time that we take to introduce any guests that Rotarians have brought to the meeting this week. So Rotarians, if you have brought a guest, if you will please line up at this microphone over here. State your name first, guests, then state the name of your, Rotarians, then state the name of your guest. Guests, when you hear your name, if you will please stand so that we can take note of your being here with us today. And I'll start right now with Bridget Johnson.
Hello, Bridget Johnson. I am a global Rotarian, and I would love to welcome my guests.
Please stand.
Estel. Sunshine is an iRise coach for New Directions. If you've heard of our wonderful iRise program, Sunshine is one of our coaches. So thank you for joining us.
Welcome. And so our guests are asked, when you hear the bell ring next, you'll know that the meeting has been adjourned. If you will go to the table right there that says, "What is Rotary?" and spend about 5 or 6 minutes with Jay Mallory, and Jay is actually at your table, Jay. He will be the person that kind of gives you an overview of what we are all about. So for Rotarians in the spotlight this week, we want to congratulate Kevin Fields. Kevin is our club board secretary, and he's also the CEO of Louisville Central Community Centers. And he and his team, once again, did an excellent job hosting the West Louisville Economic Mobility Summit and the Sam Watkins Jr. Light the Way Awards Program last Friday, which our club helped support. Many Rotarians were in the spotlight, and I really wish I could have been there. I had my own day job, New Directions, board retreat at Bernheim all day last Friday, so I was not able to join Kevin, but I heard from so many people that it was excellent as always, and we did have President-elect Ken Selvaggi. He was an award presenter at the event, so we want to thank Ken and everyone else who attended that event last Friday. I want to remind you all of our Magic All Around incentive program. As you know, this is a 6-month membership engagement that we are putting in place from October 1st through March 31st. The idea is that more activities you do with Rotary, including coming to a meeting on a Thursday, bringing in a guest, being the person who does the pledge and the 4-way test, being the person who presents our invocation. There's many, many, many different things you can do, volunteer opportunities, etc. You will get points for those, and every month we'll count those points. Every month we will give away a small prize just to kind of keep the momentum going. The first one in November is going to be, it's the Monopoly for Kentucky, Indiana. I never know exactly how to say that, but it's the game that some students put together. It's kind of popular. That will be the gift in November. I believe the gift in December will be the bottle of bourbon that Eric Gregory donated to the club when he visited us last week. So things like that for the first 5 months. But the 6th month, in April, we're going to compile everybody's work that they've done for 6 months. We'll have a grand prize drawing sometime in the beginning of April, and whoever wins that will win a trip on behalf of the club to represent us at Rotary International in Calgary in June. So please make sure you're engaged, and please make sure you get credit for the engagement so that you can be in the competition. I know Rotary is not made up of a lot of type A people who are competitive. And I do want to note, Delene asks that we do review the service opportunities. She goes through the trouble each week of making sure she talks to the committees and that we have the proper information in there if you're interested in service opportunities, because not only are they great in general, but you also get points for doing that service activity. Now I would like to invite to the podium Amy Luttrell. And Amy is the president and CEO of Goodwill Industries of Kentucky, chair of Rotary Foundation Committee, and major donor level 2 to tell you about another great opportunity to do good.
Thank you, President Lori. So today, the reason I'm up here today is that today is World Polio Day. So if you've been a Rotarian for very long, you know that Rotary has been at the forefront of the decades-long efforts to eradicate this terrible disease from the face of the earth. I always remember a statement that Bill Gates made a few years ago, and we all know who Bill Gates is. And if, in case you're thinking that Rotary has played a minor role in this process, that is not at all true. And he really gives the credit to Rotary when we're finally successful at getting rid of polio. Our club has 2 giving goals every year for the Rotary Foundation, which is Rotary International's philanthropic arm. And one of those is for the annual fund, so you're familiar with that. And our goal, our club goal for that is to give $50,000 every year to the Rotary Foundation's annual fund, And we also have a smaller goal to give to Polio Plus, and that goal is only $5,000. So with 365 members in our club, we should be able to knock that goal out of the ballpark. But I know at the same time we all get asked to give to a lot of different things, don't we? And we can't give to everything. So I just wanted to share with you a couple of reasons why I have chosen to give to Polio Plus for quite some time now. Out of all the possibilities of things to give to, I give some money to the annual fund too, but I always give as much as I can to the Polio Plus fund. So the first reason that I really like giving to this, you know, we give to a lot of different things, and sometimes we kind of wonder if it makes a difference. Are things any different because we gave our gift or not? And years ago, I saw this funny cartoon, and it was a man who had given money, and he's on the phone talking to the charity that he's given money to, and he's got his TV on, and he's looking all scowl on his face, and he says, "You know, what have you been doing with my money? It looks like the world is still a mess." So sometimes we kind of feel like that, you know, no matter whether I give or not, the world's still a mess, so why should I give? So I understand that, but in the case of polio, this has a definitive end to it, and we're not going to have to wonder about whether we made a difference. There has only been one other disease that's ever been totally eradicated, and that, as you probably know, is smallpox. This would be the second one, and I will tell you that when I started giving to Rotary's Polio Plus program, there were 62 countries that had active polio there. Just a few years ago, there were 4. Today, there are 2. Afghanistan and Pakistan. That's it. Now, admittedly, those are hard nuts to crack. That's why they're the last, but we're so close. Rotary always says we're this close. We have to get that job done, and we will get it done. I know this has been going on for a long time, and sometimes people get tired of hearing about something that goes on for decades, so we may not hear much about this. But eradicating a disease is not an easy goal, not something that's going to be done in a couple of years, but Rotary's perseverance through the years is one of the main things that's going to make it happen. And the other thing that we have to think about, just looking at this selfishly, as much international travel as goes on in the world today, it's only a plane ride away. We need polio to not be in any countries, if for no other reason, because we don't want our children and grandchildren to get it here in the U.S., and it does target children. So in some ways, it's a lot worse than COVID is. And what would we do if we could give a little money and get rid of COVID forever? I think we'd be willing to do quite a bit. So kind of related to that, this is making history. So not only will you know that your gift made a big difference, but also you can tell your family, your children and grandchildren and so on, that Rotary was at the forefront of making this happen and that you participated. I think that's pretty meaningful. We don't get that many chances to help make history on that level. But finally, we have this wonderful match from the Gates Foundation, okay? Bill Gates has a lot of money, right? And for several years, and they have this today, they've been making a match, and that match is not dollar for dollar, it's $2 for every dollar that we give. So every time you or I give $1, the Gates Foundation is going to give $2 more, so your dollar is going to turn into $3. And just coincidentally, $3 is about what it costs to vaccinate each child. So I think that's a great way to get some more money out of Bill Gates and amplify the effect of our contributions and help make history. So if you're not sure, if you would like to do this and you're not sure how to give, the easiest way for, I'll just say Delene, because Delene is very accommodating and she'll make it happen however you want to give, whatever way is easy for you. But if you can give directly to the Rotary International site, that is the easiest thing. But if you don't want to do that, we still want to make it possible and make it easy for you to give. So you can leave a check. If Delene has your credit card information and you want to authorize her to take a gift off of your credit card, she will do that and make sure that Polio Plus and our club get the credit for that. So today we have a little bit of an extra incentive, and you may be thinking, gosh, I missed that opportunity. We have a basket here that Susan Zepeda donated. Is Susan with us? I don't see Susan.
Not today.
Okay. Well, anyway, she does a lot of things for us, and so she's assembled this basket. So we may give away some things that you're not sure you want, but this looks like a pretty good basket, you know? So, and the basket itself is very nice. So we said originally that you had to give by 10 o'clock today to be in the drawing for this basket. We've extended that through the time of today's club meeting. And so at the end of the meeting, before we adjourn, we're going to draw names of everybody who's donated, and Delene will keep us up to date on that if you donate during the meeting. And you'll be eligible to win this basket on top of all those other benefits. So please consider giving. I think I made a gift this morning and it made me feel really good, and I think it'll make you feel good too. Thank you.
Thank you, Amy. If you do give in the meeting, please do slip over and tell Delene, because she'll put your name on a little white piece of paper and put it in this jar. Now I would like to invite to the podium Jay Mallory, EVP of Marketing and Business Development at ImageQuest, Chair of the Membership Development and Engagement Committee, and Paul Harris Fellow to induct a new member to our club. There's a lot of groundwater in there.
And in my cabinet, would Graham Parker and Henry Heiser please join me at the front? I'm going to induct a new Rotarian today. We're going to do this a little bit different. I'm going to start off, and then Henry's going to do the introduction and take us right to the end of the meeting. Right. So fellow Rotarians, we seek to grow our membership so that we may not only increase our usefulness and influence as a club, but also extend the spirit of Rotary throughout the community. Today it's my honor to induct new member Graham Parker. Graham, you've been elected to membership in this club because we believe you to be a worthy representative of your calling and to possess qualities that will permit you to exemplify in your public, business, social, and private life the true spirit of Rotary. You've been admitted not only to the 13th largest Rotary club in the world, but to a global organization of over 46,000 clubs, where you're also welcome at any time. Rotary membership adds value to those who engage, whether by attending meetings or events, participating in service projects, or sharing your knowledge and talents as we carry out the principles of Rotary in the community. So we would now formally induct you as a member of the Rotary Club. Everybody join me in welcoming Graham.
All right, Graham, here we go. I don't know where to stick this. Hello, everyone. President Laurie, I'm delighted to be part of this induction. I'm only allowed 2 minutes, so let me tell you, there's probably nobody I know in this club's history that has the Rotary International background as Graham Parker. His father and his mother from London, that native of London, were both club presidents, and both mother and father were district governors of Rotary International in London. And his father was an officer of Rotary International British Isles. So, again, welcome, Graham. This is really amazing. Graham is a Peabody Award-winning arts executive with over 2 decades of experience and since becoming Chief Executive Officer of the Louisville Orchestra in 2022, he has secured recently $4.3 million from the Kentucky General Assembly for statewide tours. All you nonprofits just eat your heart out. It's just amazing and well-deserved. And introduced Music Without Borders, now serving over 30,000 people annually. Now, I asked Graham, how many productions does he organize and run a year? And there are about 60 concerts. And if you all attended last week in Carmina Burana's with 425 people on stage, and it was sold out. And these are the kind of things that we have in our community, thanks to Graham. He served as president of Decca Records USA at Universal Music Group from 2016 and 2021. And I want to mention that Deutsche Grammophon is part of that group. And the reason that the Louisville Orchestra and Teddy won the Grammy Award last year, or was it this year? Was it this year? This year is because of Graham's relationship with Deutsche Grammophon. It's a big deal. And he was also general manager of station WQRX, which is very famous, and the executive director of the Orpheus Chamber Orchestra, plus a management background with the New York Philharmonic and the Chamber Music Society of Lincoln Center. He also has an honorary degree, doctorate, are you Dr. Graham Parker? No, something like that, from Oxford Brookes University, where he trained in flute, piano, and conducting. So he wears many hats, and I am so delighted you are with us today and for all. Welcome to Rotary.
Welcome, Graham, and thank you, Henry and Jay. Delene, did we want to get a picture of our new member, or do we usually do that at the end?
I snapped one.
Okay, so you've got it. You've got it covered. I should have known that.
I don't know even how to password.
Okay, now I'd like to invite to the podium Adam Fields, System Director of Planned Gifts, Major Gifts, and Campaign at Norton Healthcare, to introduce today's speaker.
President Lori, good afternoon, fellow Rotarians and esteemed guests. Today I have the distinct honor and pleasure of introducing Dr. Daniel Blatt. Dr. Blatt joined Norton Children's in August 2020 as a pediatric infectious diseases physician. He's a pediatric transplant infectious disease specialist and a member of Norton Children's Hospital's Infection Control Committee. In addition to his clinical role, he is an assistant professor of pediatrics at the University of Louisville School of Medicine. Dr. Blatt graduated with the highest honors from the University of Medicine and Health Sciences in St. Kitts, where he earned his medical degree in 2014. He completed his residency in general pediatrics in 2017 at University of South Alabama Children's and Women's Hospital, and then served as a fellow in pediatric infectious diseases at Hasbro Children's Hospital for 3 years. Clinically, Dr. Blatt is interested in transplant pediatric infectious diseases, global health, and infection control and prevention. In addition to providing care domestically, Dr. Blatt has international experience. He treated residents in a rural village in Nepal in 2014. 2 years later, he was a pediatrician for an 80-bed inpatient unit at Kibogora Hospital in Rwanda. Dr. Blatt views being a physician as one of the most privileged careers because of the responsibility and honor to heal those who are sick. He specifically chose pediatrics because of his natural connection with children. Dr. Blatt is certified by the American Board of Pediatrics and General Pediatrics. He is a member of multiple national organizations, including the American Academy of Pediatrics, Pediatric Infectious Diseases Society, and the Society for Healthcare Epidemiology of America. Please join me in welcoming Dr. Daniel Blatt.
appreciate it. And thanks for welcoming me here today. I'm really happy to be here. It's not only a great day, but it's World Polio Day, so that's also a great thing. It's really an honor to speak at Rotary Club on World Polio Day today, as we've alluded to earlier in the meeting. Rotary has a really strong presence in polio's history, and we'll go through a little bit of that today. So, I don't know how many healthcare lectures you can get here, so I'm not going to make it too medical. Thousands, yeah. But I do want to put you in the mind of a public health official, in the mind of a doctor, because infections, they're a global thing. They infect everyone, and they persist through kind of all realms of society, right? They affect not only healthcare, but businesses and education and economics. But we have to know where they come from. And once we know where they come from, that's how we can know how to stop them. And so we're gonna take a journey through that today. So my lecture is called Infections to Pandemics, the Intersectionality of Science, Healthcare, and the Social Ecosystem. And hopefully it's more of a talk than a lecture, because no one likes a lecture. All right. So we're gonna discuss how a pathogen becomes a pandemic. And not to give you PTSD about pandemics, because we just went through one, but I do want to talk about how our most recent global catastrophes has developed, and what happens to society as a whole when that's uncontrolled. So I don't think many of you were around for this one. This is pretty ancient history. But in the mid-14th century, there was something called the Black Death. And this was mostly in Europe, but it encompassed much of North Africa and Asia. And it was caused by something called Yersinia pestis, which causes plague, which I'm sure a lot of you have heard of. So this map shows the spread of plague all throughout Europe, Asia, and Africa. So bubonic plague, by the way, I made these on PowerPoint, these cartoons. It took a while, so I hope you're impressed. So plague is spread from flea bites. And these fleas come from mice and from cats. And in a 14th century city, just think about that. The sanitation is poor, people are all living together, it's very congested. So the chance of a flea bite is really, really high, right? So plague spread really quickly. And in addition to that, there's something called pneumonic plague, which is spread from respiratory droplets, so from human to human. And so plague spread really, really quickly throughout this area. And it actually spread quicker than humans were traveling at that time. But you can imagine that if you start to travel, it will spread even quicker. And so, as we move throughout history, travel has actually obviously increased in speed, and so has disease spread. In fact, air travel has increased fourfold in the last 30 years. This is a snapshot of airplanes in the sky at any random time, and I'm sure it gets more than that at certain times. So it's a lot of travel that's going on right now. So we're at risk of disease spread because the whole world is interacting. So historically, travel has been a major cause of disease transmission. The red path here, that shows the spread of leprosy. And the blue path is the spread of smallpox. And then the yellow areas, that's all malaria. That started in what's now the Dominican Republic, but it's most of the tropical world at this point. So you can see, because of human migration, exploration, and trade, disease has spread all throughout the world. And it's really shaped the way our history is written. Christopher Columbus, upon landing in Hispaniola in 1492, brought a bunch of diseases, none that we want to get. Smallpox, measles, whooping cough, chickenpox, a bunch of diseases. And it had serious consequences. 50 years after Columbus landed there, virtually all of the 8 million native Taino population were extinct. Right? This is real consequences. And this is all due to human travel. But it's not just disease exposure that propagates spread. It's also the biology of the pathogen which does this. I also made this one on my own. That took even longer. So here we have a picture of something called the R0 of different diseases. And I don't know if some of you have heard about R0 throughout COVID, but it's an epidemiologic model that tells us how fast a disease spread. So the R0 of a disease tells you that for every person infected, how many other people are expected to be infected. So you can see here, measles has an R0 of up to 18. That means if you get measles and you're around unvaccinated individuals, you could spread it to 18 other people on average. So disease spreads exponentially quickly. So if measles has an R naught of 18, why don't we see measles everywhere? And I kind of just alluded to it. But that's because of successful vaccination programs. Right here we see a graph of measles throughout the years from 1980 to 2020-ish. And you can see that measles exponentially decrease. And that's all due to successful vaccination programs. But there are, if you look over here, right over here, there's a little spike at the end, right? That's because we're still seeing sporadic outbreaks. We have good vaccines, but there's still sporadic outbreaks. And that's because in 2020, something happened, and we lost a lot of the ability to vaccinate our children, right? So we've seen big lapses in vaccination programs, and that's all due to COVID. And not just COVID, but COVID propagated other things like misinformation, loss of access to care, and we'll talk about a little bit of this as well. But as you can see, as soon as you have a lapse in vaccination programs, it spiked right away. So this leads into a dramatic rise in vaccine-preventable disease outbreaks. In 2023, we saw 58 cases of measles in the US in 4 different outbreaks. But as of last week, October 17th, 2024, there's already been 269 cases in the US with 14 outbreaks. 23 different states were implicated in this. So this moves fast, and we have to be vigilant about our vaccination programs. So now I want you to imagine you're me, and you're a doctor in Africa, okay, and you're taking care of patients, and you're in a low resource area, okay, so this is the scenario I'm gonna paint for you. We're gonna talk about what happens when there's a disease outbreak. So let's say we're taking care of a 17-year-old girl. She has fever, she has diarrhea, she's got these big red eyes, and her mental status has been altered. She's not acting appropriately. So we do some blood tests. We draw her blood, and over on the right, you can see a blood smear. And those red circles, those are red blood cells. But those arrows are pointing to some purple dots in those red blood cells. And those are malaria parasites. So we diagnose her. We diagnose her with something called cerebral malaria. Okay? It's a severe disease, but we can treat it. We give her antimalarials. So we give her some antimalarials. And after 3 days, she develops dark brown vomit, bloody urine. She's getting really sick. This is unusual for malaria, so maybe we're not dealing with malaria. Maybe we're dealing with something else. This looks a lot like yellow fever, which is endemic in the area. So we'll treat her for yellow fever. We'll give her IV fluids, her supportive care. Unfortunately, though, yellow fever is quite fatal. This patient passes away on day 7 of illness. She developed bloody stools, and she went into shock, and she passed away. So now we're 10 days after she got admitted to the hospital. 3 days later, a few of her nurses become ill. They have headache, they have fever, they have rash. So all the people that were taking care of her are getting sick. That indicates human-to-human transmission. The problem is yellow fever is not transmitted by humans. It's transmitted by mosquitoes. So now it looks like we weren't dealing with yellow fever, we're dealing with something else. So if we're not dealing with yellow fever, maybe we're dealing with something such as Ebola virus. And the problem now is that we've had people who are taking care of her, who are now going out into communities, they're going to church, they're going to school, they're going to the grocery store, and they've been infecting other people. And we see this during cold and flu season all the time. You know, you get sick, you go out, you don't realize you're sick, and the next thing you know, all of your friends are sick. But this is a deadly pathogen, and so that becomes a much bigger problem. So if you think you have Ebola virus, you need to tell somebody about it, right? How do you do that? How does anyone do that? Well, global surveillance of disease relies on cooperation and trust. There's no central governing body. Disease outbreaks must be coordinated amongst organizations that have mutually decided to work together. And really, if you have a lack of country-specific participation, the only negative outcome is human suffering. No one's gonna slap anyone on the wrist. This just causes death. So it's the same with domestic surveillance. The CDC relies on providers and microbiologists to feed them information and alert them of potential emerging pathogens. And then once a pathogen is identified, the CDC has different health alert networks to tell the public. So back to Ebola virus. In December of 2013, there was an 18-month-old male in Guinea who contracted Ebola virus after a bat exposure. By March 10th of 2014, the Guinea Ministry of Health put out an alert that clusters of mysterious disease characterized by fever, severe deaths, severe diarrhea, vomiting, and a high fatality rate. And then by March 22nd, the WHO announced an outbreak. From 2014 to 2016, so 2 years, Ebola spread in West Africa, from Guinea to Liberia and Sierra Leone. And there were cases that reached Europe and North America. I mean, some of you definitely have to remember when on the news, it was a big deal. We had doctors in Texas, I believe, who had Ebola. It was a big thing. There were 2 vaccines available for distribution. So if we had global surveillance and we had vaccines, why did it last over 2 years before we got this under control? Well, Ebola in West Africa occurred in 3 of the poorest countries in the world. They were dealing with domestic turmoil and lack of doctors. There was less than 1 physician per 100,000 patients. And to give you perspective, in the US, we have 2,600 doctors per 100,000 patients. And think of how hard it is for you to see your doctor. So there is almost no healthcare. So to respond to an Ebola virus outbreak, a strong infrastructure and a unified message is needed. And that didn't occur. Healthcare systems weren't prepared, culture and politics hindered the response, and there wasn't direct messaging about what to do. And people were focused on living life, they weren't focused on Ebola. So the epidemic of Ebola disproportionately affected areas with less resources available to them. It became a disease of poverty. So there's no way to discuss a disease outbreak lecture without discussing COVID. I know we're all sick of COVID, but so before SARS-CoV-2, which is COVID, we actually had another coronavirus epidemic. In 2003, SARS-CoV-1 resulted in 8,000 cases and almost 800 deaths, and it was considered to cause more fear than any other outbreak of its time. 2003, SARS was a wake-up call. It led to the revision of the international health regulations and the development of the global health security agenda. So that included 70 countries. And then in 2009, we had H1N1 swine flu. And so there were many panels and recommendations that were created to improve pandemic preparedness because of these 2 illnesses. All of that led to little change. And honestly, the recommendations weren't worth more than the paper they were written on. Since 2003, we've had SARS, swine flu, MERS, Ebola, and Zika, all to stoke preparation. But in reality, the global community kind of failed to prepare. So now we look at COVID-19, and we've seen almost 7 million deaths. And really the true excess death toll is probably much higher. More than 17,000 healthcare workers died in the first year. And this has been the largest hit to the global economy since World War II, and the greatest economic contraction since the Great Depression. It's been due in large part to a lack of preparedness. The inability to take preparation seriously, combined with population growth, environmental changes, global travel, that put the world at risk for a zoonotic disease. So countries who had less deaths took precautions earlier, and that bought time to collect information. For many countries, it was not until they had already seen widespread local transmission and their hospitals were starting to fill desperately with desperately ill patients that they finally took action. Healthcare facilities all around the world weren't ready for such spread. Ambulances were waiting in line to reach emergency departments that were too full, and as soon as you got into the emergency department, you were waiting because there weren't inpatient beds available. And then there were many examples of systems that were just over capacity. And as the pandemic developed, personal protective equipment became needed in quantities not seen before. So the world needed 40% more PPE than could be produced. And PPE became very expensive. The dark bars are pre-pandemic prices, and the pink and the red bars, those are the medium and maximum prices of PPE during the pandemic. So high prices led to loss of access, and loss of access led to inequity. As you know, healthcare wasn't the only part of society that got affected by COVID. School and business shutdowns were devastating around the world, and in 2021, UNESCO estimated that $17 trillion were lost in lifetime earnings for the current generation of students. That's equivalent to 14% of today's global GDP. So inequity was and is clearly magnified during the pandemic, and worldwide, nearly 125 million people are living in poverty directly as a result of the pandemic. So because of a lack of resources dedicated to an adaptable learning environment, an estimated 90% of students will have irreversible educational deficit. And those living without the ability to get any kind of education rose from 50% to 70%. It's almost unfathomable in the US, right? So the inequity rift focused more on women, underrepresented minorities, and underprivileged people. Globally, many women are at increased risk of never returning to school. And 10 million females are now at risk for early marriage due to the pandemic. There's been a sharp increase in gender-based violence. And job loss has also been alarming, but women lost jobs at a much higher rate than men. 39% of the global workforce are women, but 54% of the newly unemployed were women. So poverty and inequity hit the hardest those who were already disadvantaged, women, impoverished, and children. And as said succinctly by the leader of the Shipibo Konibo community, if COVID doesn't kill me, hunger will. Throughout the world, food insecurity rates rose during the pandemic. The pink bars are 2019 and the red bars are 2021. And unfortunately, it is mostly the poorer countries that suffered. They had delayed access to COVID vaccines, and they're still catching up. The green areas on the map show high rates of COVID vaccination per capita, and the brown and red areas are low rates of vaccination. So during the pandemic, rising vaccine misinformation met decreased access to care and also the devastated economies. And this allowed for a large worldwide increase in the number of children who did not get appropriately vaccinated for routine immunizations. And missed vaccinations have real-world consequences. And that brings us to polio. It took a while to get there, but now we can talk about polio. Africa was declared free of indigenous polio in August of 2020. In 2022, 2 years later, the health authorities in Malawi declared an outbreak of wild polio virus after a case was detected in a young child in the capital of Lilongwe. This was the first case of wild polio in Africa in more than 5 years. So what is poliomyelitis? So poliomyelitis is the same as polio. It's the more scientific term. It's an infection caused by the polio virus, and it mostly affects young children less than 5. It's highly contagious. It has a high R0, and it's transmitted fecally orally. So someone goes to the bathroom, doesn't wash their hands appropriately, prepares food, that's how it's transmitted. It can cause flu-like symptoms, headache, sore throat, fever, nausea, vomiting, fatigue. The big thing is, the most famous thing is that 1 in 200, not infrequently, 1 in 200 people will become permanently paralyzed. 10% of those people, they die. There is no treatment for polio, but there is a vaccination program that works really, really well. They do work. So where are we now with polio? This graph, this is where we are now. The left side is 1980, the right side is 2023, and this is showing the polio cases throughout the world. So polio has been almost eradicated throughout the entire world. But if you see at the end, there are some still little bumps there, right? It's not gone. And it's interesting, this picture is from when the first Salk polio vaccine came out and people were lining up around the corners. You don't see that anymore for vaccines, yeah. But it was a big deal when it came out. So speaking of the Salk vaccine, Jonas Salk created one of the first successful polio vaccines. And Salk was committed to equitable access of his vaccines. He wanted universal low or no cost programs. So 6 pharmaceutical companies were licensed to produce the vaccine, and Salk took no profit from that process. In a 1955 interview, he was asked by the interviewer, who owns the vaccine patent? And he said, well, the people, I would say. There is no patent. Can you patent the sun? You don't see that nowadays, but he was ahead of his time. So since then, a number of polio vaccines have been introduced and used, and they've contributed greatly to the decline in wild polio virus. So you guys are all stars here. That's why you're front and center on this slide. The Global Polio Eradication Initiative. It was founded in 1988, and it's a public-private partnership. It's a partnership between national governments and 6 big organizations: the World Health Organization, CDC, United Nations Children Fund, Bill and Melinda Gates Foundation, the Gavi Vaccine Alliance, and Rotary International. And it's the largest international public health initiative in history. And it's done a remarkable job of spearheading the eradication of polio, and it's all due to generosity of clubs like this. In the United States, we've had no endemic cases of wild poliovirus since 1979. And the Americas in general was declared polio-free in 1994. However, there have been some polio brought in by travelers, as we alluded to before. And in June 2022, poliovirus was actually confirmed in an adult who was paralyzed in Rockland County, New York. Now, there was a big epidemiologic survey of this, and they found that there was local transmission. This was not from a traveler. So this was a case that was locally transmitted in New York, 2022. And this is all because unvaccinated individuals remain at risk for paralytic polio. This is a little bit of a busy slide, but simply put, vaccination saves lives. So on the left, there are a bunch of vaccine-preventable illnesses. Most of them have childhood vaccines. And on the right, you see the percent decrease in these cases. And so you can see that with most of the vaccines that we have today for children, there's close to 100% decrease in the case rate. So vaccines really do work. In smallpox, diphtheria, they have about 100% decrease. So we are close to eradicating a number of things. Polio's up there too, it's close to 100 as well. So medicine is a social science, and politics are nothing but medicine at a larger scale. So what do we do to prepare for the next outbreak? Well, we have to get our policy members on board with listening to science. And we must have resources dedicated to responding to ever-changing healthcare needs. We can't differentiate the medical science from the social ecosystem. They really are hand in hand. And we have to continue to be able to teach people the importance of strong vaccine programs. There's many ways people get their information today. Displayed here, you're not going to be able to read this in the back, and that's okay, I'll explain it to you. This shows public confidence in different people in society. So this is public confidence of the military, of medical scientists, of scientists, journalists, business leaders, and elected officials. And I put some red arrows in there. And those red arrows started 2020. And that's when there's been a decline in public confidence in all of those fields. And so 2020, not only COVID, but misinformation and the rise of, alternative facts. So there's a lot we can do, right? Clubs like Rotary have really spearheaded, the ability to eradicate diseases, and we can do this with a lot of the things we're seeing today. It requires a coordinated effort. So I hope we learned today how a disease spreads worldwide, how we as U.S. providers and leaders need to keep studying and surveilling illnesses, and that we need to be on the forefront of medical information distribution. And our response to these pathogens through surveillance and medical treatments and public health measures, that shapes the outcome of infections. And perhaps most importantly, a world of inequity is a world at risk. Thank you.
Thank you so much, Dr. Blatt. So if you will remain there for just a few minutes, we're going to open the floor to see if any Rotarians have any questions. If you are a Rotarian, you know what to do. You come over here to the microphone, ask your question. The rules are on the screen. I'm sure you're familiar with them. And I'm sure that would do.
You're welcome.
Thank you so much for coming today. My name is Larry Salon. I'm a retired salesman. My question is, I had about 3 questions in my mind, but the main question I have is, I heard this morning that in Gaza, polio is present, and that the UN was going to, through WHO, do the vaccinations. But while
it's a really great example of a terrible issue that leads towards healthcare consequences. And we see that all the time in areas that are torn by war or famine or poverty. That is when we see these diseases pop up. When we say eradicated, it doesn't mean there's no virus that exists in the world. It just means there's not a lot of cases, which means there's still a little bit left. So if you have a disruption in the healthcare system, they come back. And so it's an ever challenging process.
Dr. Blatt, I'm Henry Heiser, Star Purchasing Solutions. Thanks for being with us today. I'm curious if you would speak about the deniers. People like former President Trump, Rand Paul, aggressively saying this is a farce, you don't do anything, it's bad. And how do you deal with parents of children who won't allow their children to be vaccinated?
That's a great question, and it is something that keeps me up at night. Vaccines are one of the most proven medical interventions we've ever had, about as proven as washing your hands. And it's really a shame when the public loses confidence in that. I think it's dangerous when people come up with their own ideas about vaccines without consulting with the actual science, because it does lead to death. It's not always just a personal choice, it affects other people. You know, if you get infected with something, other people also can. So I think leaders who do not believe the consensus in medicine that vaccines are a wonderful thing, it's dangerous rhetoric, it really is. In terms of parents, that's a different story. Parents almost universally want to take care of their children. And it can be really frustrating as a doctor, especially one who dedicates their lives to vaccines, to hear parents concerned that vaccines aren't safe or that they hear ways that they may be harming people. But at the same time, I know their parents have their child's best interest at heart. And so it takes a lot of effort. It takes a really strong bond that needs to be made with the parent to be able to talk to them from the heart about vaccines. So what I do when I have a situation like that, I show the parent the best I can that I really care about their kid, that I'm willing to listen to any information they want to show me, and I take the time to walk through it with them. Not every doctor has the time to do that. I'm lucky I do as a specialist, but it's a real problem, and it can't just be on physicians to disseminate that information. It really needs to be on all leaders of society and all leaders of community.
Doctor, my name is Fred Cowan, and my question follows closely on the one that Henry just asked, which is, since there are obviously a lot of people in society who are either anti-vaxxers or they have this theory that somebody is controlling something that's not in their best interest for whatever purpose, they like conspiracies, whatever it happens to be. Has medical science, the community, as far as you know, undertaken any kind of effort to figure out in a systematic way what the cause of that is, and if you have, or if there is such an effort, what potential remedies are there to that?
That's a great question, and it's something that there is a lot of study on. Our division at the University of Louisville has a number of research projects dedicated to figuring out the best way to teach people who have vaccine misinformation thought processes. There's a saying that I've used in a previous paper that I think is applicable to this, and that it's really easy to scare people, and it's really hard to unscare them. And that's where this comes from. So people are scared of new things and things they don't understand. And if they hear something that may be dangerous, it's going to be hard to prove to them that it's not dangerous, especially when it comes to their children. And so that's why this is so dangerous. In addition to that, the battle against misinformation is really ever changing. You know, a few years ago, social media was different than it is now. And in a few years, it will be different than it is now as well. And the ability to counteract every false claim takes it is difficult because it takes a long time to dispel every false claim. And so we're dealing with different narratives, different mediums, different fears, and each one of those things takes exponentially longer to disprove than they do to say.
Thank you for being here, Dr. Blatt. I've got 3 questions for you. A couple of them will be really quick. Oh, I'm sorry, well,
Nice to meet you.
Last time I checked, there you go. All right. Anyway, so the first one is, I contracted COVID at the Petri dish called the speedball. And I've gotten a couple other vaccinations, but I haven't gotten the latest one, nor has my doctor suggested that I do so. And the folks that I know have really hit them hard. So what is your take on, what should we do about the latest COVID vaccination?
Yeah, great question. So, the recommendations for every vaccine that comes out goes through the CDC as well as the American Council on Immunization Practices. And so those are the smartest vaccinologists in the country, and they get together and they decide yay or nay, we should recommend this vaccine. So the COVID vaccine that is out now is just as recommended as the previous vaccines. It's just as recommended as the polio vaccine. And everyone's different, right? Some people, there may be some contraindications. You may be allergic to the vaccine. But in general, the recommendation is most people should get it. Now, not to go on too much of a medical tangent, but in general, when people say they got hit hard by the vaccine, I actually almost look at it as like a good thing. And it sounds weird, but when you get hit hard by a vaccine, that is your immune response making antibodies to the vaccine. That's the vaccine doing what it's supposed to do. And so you may feel bad for a day, but it's better than, getting severe disease. And the vaccine, it doesn't prevent infection, it just prevents severe infection. And so it's kind of like wearing a seatbelt. You don't know you need it until you've gotten in a car accident. And you're always going to hear cases of people who get sore neck or whatever from a seatbelt, but it doesn't mean you shouldn't wear it. Same with the vaccines.
Thank you. The second question, I'm a friend of was a friend of Jenna Bush Hager's father-in-law, John Hager. And John contracted polio when he was like 37 years old, when his son got the live virus. Is that the way we use live viruses today still?
So some areas of the world do. So there's a live oral polio vaccine, which is now, in the mid-90s, it switched to an inactivated vaccine. So live virus vaccines always have some risk of the disease. Mostly that's for immunocompromised patients. They do tend to work a little bit better in terms of protection, so there's some pluses and minuses. But this is the beauty of vaccines, is that we have really large-scale studies on them. And when there's enough of a risk-benefit imbalance, those vaccines get taken off the market, out of the recommendations. So it's not like people put out vaccines and then we say, go at it. There's constant studying of the effects. And as soon as the scientists, the public health officials say, the benefit is not outweighing the risk, they get pulled, or they get adapted, changed.
Thank you. And the last one you haven't talked about, could you talk a little bit about the folks that suggest that vaccines cause autism?
Yeah, that originated from a paper from Andrew Wakefield, a British scientist, who made up, not even fabricated, made up data for some alternative reasons. And it's been one of the most dangerous narratives that we've ever had in terms of public health. There has been no link from vaccines to autism. And there is actually one of the biggest anti-vaccine groups in the world launched a very, very expensive study to try to prove that there was a link. And they begrudgingly published the results that actually showed there was more people who had autism who weren't vaccinated than the ones who were. So there is absolutely no real link between vaccines and autism.
Doctor, thank you for being here. My name is Nick Garner. I'm a lead software developer with Miter Corporation. Among other things, we run an FFRDC that is partners with the CDC pretty regularly, so I really appreciate your work here. My thought process when I hear any example of a thing that's wrong systemically that we have a clear solution for, the first question that my mind always jumps to is like, what are the entities, the powerful entities that benefit from these systems staying broken? Like, who are the folks who are aligned against us taking these steps, these preventative steps that would cause so much cost and misery and suffering down the road. Have you given much thought to that? I'm curious to hear your thoughts about who benefits from this being broken.
I don't have an answer to that, even though I have given a lot of thought to it. I've read data, and I may be misquoting it slightly, but I've read data that 90-something% of vaccine misinformation comes from 6 people in the world. And so I don't know what the motivation is, but once this gets out there, it spreads. And again, it's fear. So I don't know if everyone's benefiting from this spread of misinformation. It literally may just be fear for a lot of people. Now, I think the solution to it can be broken, and that could be due to corruption, in that we have healthcare infrastructure in place to distribute vaccines, and that could be negated from corrupt governments or things like that. So I think the solutions can have some nefarious people behind it, but I don't know where the misinformation comes from. I don't have an answer.
Doctor, thank you. Chris Manzo, Sandbox. Where should we go for good information?
Great question. I was hoping to ask that. First and foremost, if you trust your doctor, go to your doctor. That's what they're there for. They may not have all the time, they may not have an hour to talk to you about this, but they're definitely the first and foremost person to go to. But if you want to just do it at home, that's fine. It's fine to Google as long as you ask the doctor questions about what you find. But in general, the CDC has amazing resources for patients, for scientists. So the CDC has a ton of information out there. And then a lot of specific children's hospitals or adult hospitals have their own resource center, specifically for vaccine. The Children's Hospital of Philadelphia, CHOP, I don't remember the website address, but the CHOP vaccine page has incredible resources specifically for vaccines and for parents. So I would go to the big guys, CDC, big universities. Those are the people to go to. Anyone else, it's kind of a guess.
Thank you again, Dr. Blatt. We're so pleased that you and your guests could join us today. Incredibly informative, and I think I learned a little bit today, so thank you.
I did want to mention that you do not have to be present to win. I want to thank all the people who donated today, especially Chris Manzo, who donated $1,000, and Amy Luttrell.
Amy, would you like to come up and draw? I guess if you're in here and you win, I don't know, you may have to. All right, here we go. Craig Mooney. Club treasurer, all around the guy.
Get a picture real quick and then go ahead and announce the next meeting.
Amy.
Come on, Amy. Come on.
Next week we have Susie Eastman. If you'll remember, Susie has spoken to us before. She's very entertaining. She's from our area, went out to California, came back. She's a filmmaker and president of 502 Film. You need to RSVP by Monday at noon as usual, or of course you can use the QR code right here. We lost our guest today. She had another meeting she had to go to. So Jay, you are off the hook, and we are adjourned.